Great. Thanks everybody for joining us today for our foster information session. My name's Steve. I'm the foster manager. We have some special guests here to talk to you about various topics related to fostering for St. Hubert's. There's a full docket, so I think we're going to get started right away. Let's start with our medical manager, Veronica Greco, who's going to talk to us about some of the things that we might see in medical foster cases. Ronnie?
Yep. Hi, everybody. Well, thank you for joining. And since this is fairly brief, I won't go into too much detail, but I'll just give a brief overview or summary of what some of the things you might find if you were a medical foster. One would be administering medication such as antibiotics or pain medication, and none of that would ever be injectable. It would always be oral or topical, such as a cream, but oral would be a tablet or capsule or a liquid suspension. Usually with cats, it would be a liquid suspension. Sometimes it's a capsule, and often with cats with a capsule, you can just open it up and hide it in some yummy food. Dogs are easier with tablets or capsules because you can hide that in a yummy meatball of cream cheese or peanut butter. And these would be medications that we would, of course, supply and give very detailed instructions. There would be on a schedule, like a scheduled time frame of when you would need to administer it. And we would have follow-ups. You could call us at any time, and we would have follow-ups with rechecks with either the technicians or with a veterinarian, depending on the case. And so some of those would be upper respiratory infection, or it could be a wound that we need, the animal needs to just heal and needs some extra TLC outside of the shelter. Some other cases would be if there was a specialty type of surgery, such as a limb amputation or a broken leg, a fracture that got surgery, and don't want the animal in the shelter after a major surgery like that. That time for recovery and recuperation really ideally needs to be in a home setting and not in the shelter. The shelter is as nice as we try to make it. It's a stressful environment, and it's just not a good place for a type of surgery, a recuperation time after a major surgery. So that would be definitely, again, specific instructions, whether it's you have to keep the animal confined a little bit more. If it was a limb amputation or a broken leg, maybe in a big crate or a smaller room, and again, we would supply all the necessary tools that you would need. And again, would require, all of these would definitely probably require visits back to the shelter for checkups with our veterinarian or with the technicians. And some other cases might be like senior cats that might need a little bit extra TLC and some R&R. So they may need a little bit enticing with getting to eat, if you want them to eat well, or a specific diet. We would again supply that specific diet. And they might need some sub-Q fluids, which I can demonstrate in a moment, but that's just, and that wouldn't necessarily be every day. Sometimes it would be just a couple of times a week, and it might not be the whole time of while it's in foster. It could just be a short period of time till the animal got more hydrated and started to feel better, if it was a stray or out in the street for too long. So, and it's not as scary as it seems. And again, we would always demonstrate. You could come to the shelter and we would demonstrate on a live animal, practice a bunch of times, have you practice it so you would completely feel comfortable with it. And we're also always available by a phone call or email or texting, whatever, if you needed extra suggestions or tips or help. And I can demonstrate if you would, do I have time, Stephen, to demonstrate subcutaneous fluids?
Yeah, we have time. Yeah.
Okay, so I don't have a live animal with me, but I have my little stuffed animal dog here. So I'm going to try to see. Whoops. Did I lose you?
Yep,
Stephen?
We still have you. You're still there.
Oh, okay. Can you see? Because I've lost the camera.
The dog's kind of in frame.
Okay. Well, because the camera on my computer's not working all of a sudden. So, all right. You tell me what you can see and can't see. So we have a dog here, and we have a bag of fluids. This is what it would look like with a line attached to it. And we would just, at home, you would find a hanger or something to hang this bag of fluids up higher than where the animal is. So I'm going to put it over here on a hook. And then you have the line. And you would generally you want to go on the back between the shoulder blades. That's where it has the most excess loose skin. And you want to make a little tent with it. And you just want to, with the needle, you would go just under the skin a little bit. And then you turn, there's a little toggle switch that you turn it on and release a little clamp, and the fluids flow from the bag into the animal. And there's markers on the fluid bag where you would see when you would need to stop administering the fluids. And sometimes you just have a towel wrapped around the animal. Oftentimes they handle it pretty well on a table or on your lap, or you might need another person in your family or household to help you. But that's basically it. It only takes a few minutes, and then you stop and you pull out, okay? So that's how you demonstrate that. And again, I'm sorry, but I'm not seeing the, I'm not back at the camera for some reason. Can you see me now?
It's okay, we can still see you, yeah.
Okay. So that's basically it. It would be more just like monitoring medications. It might be, we do have some fosters that do ringworm generally that's with kittens, but sometimes adults as well. And that would be if you had an extra room or a bathroom in your house that could be like an isolation room where you wouldn't have other foot traffic of other animals or people. And again, that would be administering an oral medication once a day, and it's a liquid. And it would be a special bath dip twice a week. And that would go for anywhere from 3 to 4 weeks generally, sometimes maybe a little bit longer. But we do have quite a number of fosters that actually do that. So that's really helpful. And we find that the animals clear up much quicker outside of the shelter than in the shelter with that. And that is, it's not as scary as people may think or assume, or it's not a parasite. It's a fungus that is actually normally occurring on all animals' fur. And it's just in cases where the animal is stressed or immunosuppressed for some reason, generally it's by stress or overcrowding, that the fungus overcomes and overtakes a little bit too much of the animal. And then that's how that happens. But it's not fatal, and that's something that's not as scary as people may think. But that's about it. And I think I'm probably used up my time.
Thank you, Ronnie, for that overview. Do you happen to have a med sheet there, a medication sheet? And show everyone.
I don't think I have one handy with me. I may in my pocket actually here. I actually do. Okay, so
So if your
it's an
animal's
example
on
of
medication.
one that's, it's finished, but this is what one of our med sheets would look like. Can you see it?
Raise it up a little bit more.
Is that better?
I mean, it's kind of hard to see, but it's okay.
Out there, is that better?
Yep, there we go.
Okay, so that's what a med sheet would look like, and we would mark off the dates that you would need to administer it, and we highlight the cell blocks where you need to when you would need to give the medication. So and we write very specific instructions. It's very easy to understand, and again, any questions were always just a phone call or an email away.
And that would go home with you with your foster animal.
Yes.
On any medicine.
Yes, that would go home with you with the animal. This way, there's no, you can check off or initial when you've given it. So you know, in case you have other people in the household or in case, so you don't forget that you've already given the medication and so you don't double dose or not give it. So it makes it a little bit easier to remember, makes it actually a lot easier to remember. So it's not so confusing and you can have all your sheets out and you know exactly, you can refer back to them because they'll have all the instructions on the sheet as well.
All right, thank you, Ronnie, for.
You're welcome. Thank you.
Switch gears and go over to behavior. We have our cat behaviorist, Joe, and Colleen and Tatiana are two of our dog behaviorists. And they're going to go over a little bit about what you might see with behavior cases.
Yeah, hi, everybody. Thank you so much for taking an interest in coming to the info session. It's super cool to see so many people. So I'm going to talk about cats first, and then I'm going to turn it over to my dog friends. Because cats are just that much better than dogs, and it's okay. Everybody knows it, and it's totally fine. So the shelter system wasn't really designed with cats in mind, and that's kind of a problem that we're still working with as an industry, which is why it's really cool that we have this foster option. And it's really, really important for cats because a lot of them in the shelter system are just going to be too much, and it expresses itself in a couple different ways. So you're going to be seeing cats who are a little too timid, and these are cats who, you know, they might go into your home, and I've seen cats leave the shelter who haven't moved in their entire stay here, and within an hour of going home they're walking around the house and just being normal animals, and it's really great to see that. And I've seen some cats take a little bit longer. And so our foster coordinators are really great. And I touch base with them. We have a really nice dialogue. And so we can really find kind of the cat that fits in best with kind of your schedule and your life. And that's really a lot of what you'll be doing with behavior cats. They're going to be a little too nervous. They might be a little too overstimulated here. And so they need to go and just kind of get away from it all for a little bit. They might be a little understimulated. So you're going to see cats who are kind of going a little kooky because they're just so bored. And so those are the cats who, if you have a little more time, they're actually really fun work from home buddies because you can take a break and you give them a 10-minute practice session, or you give them a wobble feeder to kind of get those mental gears turning. And I think overall for cats, getting them into a normal home so they can start experiencing routine and get an environment where they're not confined, where some cats who might not like other cats, we have a bunch of cats who need cats. We have a bunch of cats who would be fine with other cats. And then we have some cats who hate the sight of another cat. And that's really hard in animal shelters to keep them totally isolated. And so there are some animals that we'll be sending out who they're lovely animals as long as they don't see another one. And so setting up that environment and kind of recording how the cat does and really kind of keeping a running log to see the change in them. And, you know, it can be changed that's this much, it can be changed that's this much, as long as we're seeing, okay, you know, day one, what's happening on day two. And we're really looking for the big picture. So if you're seeing things and you're a little bit nervous, and you're a little bit nervous about saying, hey, I'm seeing some concerning behaviors, I'm not sure if this is 100% right, you know, please stay in contact with us. We're here as a resource as much as the medical team. If we need to adjust a game plan, it's more important that we have that information and we're able to talk honestly about our animals, because what you guys are doing is giving us information and being a pair of eyes to get knowledge that we cannot possibly get in a shelter system. And what that actually does is it helps keep pets in homes, and it helps keep our adopters safe, because we have so much more information about triggers, about ways that if an animal is a little, you know, spicy, how it can be managed, how they actually exist in a home. And sometimes it's a completely different portrait. And that's what's really cool. Another also about our fosters is you might be getting a cat and it might do well in a home versus a shelter, and you're kind of just their guardian and curator for adoption. And the cat would just kind of stay with you and then find a home, because coming back to the shelter, its behaviors would cause its length of stay to be longer. So essentially, from my perspective in cats, you guys are really a safe haven and about creating structure and environment and just giving them a place where they can thrive. And sometimes that means being really hands-on, especially with younger kittens. And sometimes it means being a little bit more hands-off and just kind of seeing where a cat's ceiling is, especially with the older ones. And so, you know, is this cat just kind of, he's gonna sit on his couch, I'm gonna sit on mine, we'll blink at each other, I'll give him food, and that's the end of it. And that way we can at least tell adopters, so that when that person comes, we know that this is the cat for that person. So that's my take on cats, and I will now turn it over to our dog behavior staff, and I will just slowly move out of frame.
Yes, and we'll slide in. Hi, I'm Tatiana, this is Colleen. So I'll get started just giving you a little bit of an overview. First of all, I just wanted to let you know that we really, really appreciate you guys. You're a special group of volunteers. We know what it's like to, you know, bring in an animal home that you may not necessarily know. But the reason, you know, so thank you for doing that. The cases that you may see with dogs, typically we ask for assistance with either very fearful dogs that we can't get a good read on here in the shelter, dogs that may have some, you know, stranger danger, need to be a little socialized a little bit better, or they may be on the flip side more leash reactive or have resource guarding behaviors. So did you want to?
So
Sorry, we're just passing around.
so what we really need is we just need fosters who can take these dogs into their home and record these behaviors and really stay in contact with us and let us know the changes that are happening, or if there's no change at all. We really rely on you guys, because sometimes they won't show these behaviors in the shelter. So especially with fearful dogs that need socialization or may need help with another dog, it may take them a few days to even, you know, come out from under your desk. Or going into a home with a friendly dog, they may come out of their shell right away. Like I said, we don't really see that here. So having you guys to update us every single day and record what's going on is really helpful to us. And we're available just as much as medical is as well. We can be contacted by email. So whatever you really need in the home with this dog, we will always be there for you.
And you know, what we'll look for is very objective information from you in terms of dog's progress. And we do have a form that we can provide you with to help you gather that information. If the dog is not doing well, by letting us know that, you're not getting the dog in trouble. You're giving us the information we need to either help you troubleshoot or perhaps change something in that dog's environment. And, fostering, and I have fostered dogs before from actually a different organization. Most of them were usually very fearful to the point where they wouldn't come out of their crate. But there's a bit of a risk and reward with fostering, right? In that sometimes the outcome for the dog may not be positive, but that gives us really good information whether they can function as a family pet or whether they're safe to place in an environment. Or maybe they're, and sometimes what you'll see is maybe more than even we see, because of the fact that they're in a home setting. And some dogs may do really well in an institutional setting and have basically and panic when they're in a regular setting. So
And like with fearfuls, like normal things like the TV coming on or the lights going on, or like the sound of the fire alarm or something, those are things we don't get here. So if we find cases that a dog is sound sensitive, we wouldn't be able to figure that out here because there's always noise going on. So types of cases like those, so fear, reactivity, guarding, and even cases with dogs that really can't settle here, who have the inability to not settle. Sometimes we see cases where they are losing it in the kennel and then they go home and then they are just a normal dog and can relax nicely. So those are the types of fosters we'll be looking
Allison
for.
to the front. Allison to the front, please.
Does anybody have any questions?
If you have any questions, you can type them into the chat box and we'll see them.
Just click the chat, scroll, just make the chat.
Hold on a sec.
sidebar. Make sure we can see it.
Oh, nothing. All right.
Yeah, we don't see any questions. So
Thank you for taking the time. That was really great.
wait, hold on. And a fostering, should you keep them separate? You want to take that?
Well, it depends. If you have a dog and are fostering, should you keep them separate? It depends. I mean, sometimes with dogs that need other dogs to get them out of their shell, they would really benefit from having spent time with your dog. But normally we wouldn't put dogs in a home if there was another dog that we knew they didn't get along with other dogs. Usually it's with dogs that need other dogs to help them, come out of their shell.
And we would obviously do a meet and greet with your dog because we don't want to put our dog in a position where they may make a bad decision or your dog in that position as well. So our goal is to match you up as best as possible. Okay, well, if you guys think of anything, wait, hold on, more questions are popping up.
How long do you usually have a foster? That depends too. You could have it for a week, you could have it for a month. With some cases, if they have to be put on behavior medication, it takes about 4 to 6 weeks to actually start to kick in. So that would be really, really helpful if you could keep them for the time until it actually, is in their system.
And we do have a foster that's doing it now with one of our dogs, who's doing really well in the shelter, was adopted out and just showed some challenging and threatening behaviors. And this foster had a previously more challenging foster, and she agreed to take this one on and see, if we can put her on medication, whether some of these behaviors can be taken care of.
Would you want to foster a cat but never have had a cat?
Okay, Joe, take that.
So first-time fosters are always welcome, and like Tatiana and Colleen were saying, we really do try to match up who is fostering what, because the last thing we want you guys to do is to volunteer your time, make this sacrifice, be willing to do this, and then we mismatch you and it is a totally horrible experience. That would just be silly on our part. So we have plenty of cats who kind of are just need love animals, and they would kind of just go into the house and just need a little bit of confidence. So we have plenty. We get a lot of first-time cat fosters.
So the next one is, Stephen, I think you can take that. So are these fostering situations only for those animals with behavior and medical issues?
So there are a few different types of fostering that we can get into in more depth. So for this session, it's just a general overview, but we're going to have future sessions where we go into more depth on not just the medical behavior and community engagement, but also on fostering for things like litters of puppies and kittens, or specific issues like we had one for ringworm already, but other types of medical issues.
I think we have time for like one more.
Do you do meet and greet at St. Hubert's or at the home? We do them here, but I do know in the future some have been done in the foster home. If you have a dog currently, how can you ensure the foster dog matches you as a good fit?
That's what the meet and greet is for.
Yeah, and it'll be with the behavior staff. You supply the equipment for foster, yes.
But if you want to get your own equipment, that's fine too.
All right. So if you think of any other questions, please don't hesitate. You can just email Stephen and he will pass along any questions appropriate to us.
That's really it.
Okay.
Thanks a lot, guys.
Thank you.
Thank you.
So our next speaker is Jen Gregory, and she is the Community Engagement Manager. So Jen, do you want to take over?
Yeah, absolutely. So again, I want to say thank you as well for everybody on the call. We appreciate you and you wanting to foster animals. The two programs I'm going to talk about as the Community Program Manager is our Safe Haven program and Emergency Boarding. The two programs, Safe Haven, we have families that go into domestic violence situations. We are partnered with 10 domestic violence agencies where they have client care managers and they will contact us. If they're going into a Safe Haven program, they're going into a safe house. So everything is very confidential. Right away, we get the animals from the safe houses directly to the shelter. Now these animals, whether they're cats or dogs or rabbits, or I had a bird one time, we don't want to keep them in a shelter environment. We're able to help these domestic violence victims for 75 days. That way their families can get on their feet. Their client managers are having, working with them closely to find them a place to live, and they'll be able to get their pets back. So this is huge because if we didn't have you guys as foster, we wouldn't be able to do this program. We do about 40 to 60 animals per year in this program. So again, any of the animals that come in, whether they're cats or dogs, we bring them in. Everything is strictly confidential. We will have our behavior team assess the dogs, and we assess the cats as well. And we see if we are able to place them in a foster that would be, good for the specific animal. Then we get them up to date on all of their vaccines and spayed and neutered. Most of this happens within a week, and we find the appropriate foster. With the Safe Haven program, the only stipulation is, again, it's a domestic violence situation, so we can't post photos on Facebook. You can have people come over and visit the pets, but you just don't want to take any pictures and post them on social media, things like that. But again, with this particular program, it wouldn't happen if we didn't have fosters. If there is a behavior issue with the dog, they would be able to stay here at the shelter, but what better than the families knowing that their animal is in a home with another loving family while they're dealing with a situation like this. So that is why I love that we have this program. And we really are the only shelter in New Jersey that does this program. There's another domestic violence agency that helps, but people can call all day long and try to find a shelter that does this program, and we really are the only one in New Jersey. The second part of the program is called emergency boarding. This is pretty much the same thing, except we open it up to whatever is going on in someone's life. So whether it's a house fire, someone going into rehab, someone going in for a medical procedure, homelessness due to COVID, someone going into the hospital. This may be a period of time where families need anywhere between 20 and 40 days. And they know that they will get on their feet, but they have no one to care for their pet. They have no relatives. They don't have money for boarding. So again, we will take the animal in. We will do behavior, make sure the animal is safe for foster. We will do all of their medical, and then the animals will go in foster. So right now I have a couple fosters that we have tucked away that have done things like this. A foster can go for this situation between 30 and 80 days. But we have an 85% reunification rate with these situations. I mean, it's just amazing. People would be losing their pets if we didn't have this program. Last year, we had 80 pets come through the program. And surprisingly, knock on wood, we haven't had a very big uptick since COVID, but we always want to have fosters in our back pocket that will be able to do this on a drop of a dime. So we appreciate it. Again, we will know the behaviors because we know the owners of these pets. We supply all the supplies. You don't have to commit to the full time of foster. Anything to get the animals out of the shelter would be great. I think that's about it. Oh, and visits. We allow the families to visit their pet. It would be at the shelter. With COVID, we're doing things a little differently. We allow them to visit once a week, or I'm sorry, once every 2 weeks. A lot of families don't take advantage of once every 2 weeks because they're worried about where they're going to live. So they may visit once a month. But in this case, we ask the foster what's convenient for them. If they could drop the dog off at the shelter for half an hour, the family can visit. The foster can go out to lunch and just pick the dog back up. With cats, we don't do that only because it's very stressful for cats to keep going back and forth. We find with the dogs, it's just really, it's nice. It's a nice ride to the shelter. They can see their family and then go back to the foster home. And that's pretty much it. And again, I'm available for support. I would be the contact person for all of these foster situations. You can send me pictures, therefore I can send them over to the family. So that's an easy thing the fosters can do. And then I just pass them along. Typically, we do not connect the families with the owners, only because it can get sticky. Sometimes, I hate to say, but owners can be a little crazy and they could bother the fosters a lot. So I just try to be the point person. But otherwise, that's the two programs. I was looking at the questions. This one question was, can we say, oh, hold on, where are we? Hold on. Specific size of the animal due to the animals in foster home. If you are on my foster list and you say you want a small dog or you want a cat, or if a small animal came in, you would be my go-to person. So I will collect as many names as I possibly can for help for fosters with our emergency boarding and our safe haven program.
And after you send in your application to foster, you'll receive another questionnaire with questions about what size of dog you're willing to foster.
So if anyone doesn't have any questions, that's it for our two safe haven and emergency boarding programs. I appreciate everybody on the call.
Thank you very much for joining us, Jen.
Thank you.
And on the application itself, there is a spot where you can check off that you want to foster emergency placement animals. So we're running a little bit low on time. I want to thank everyone for coming today, and thank you to Jen, Joe, Colleen, Tatiana, and Veronica for spending the afternoon with us talking about different fostering aspects. Like I mentioned earlier, we are going to be doing more deep, in-depth sessions about more specific foster events and what you can expect in more specific foster scenarios. So keep an eye out for those invitations. You all have my email address as well, and you can send me any questions that you have. svalentine@sthuberts.org. If you have questions for anyone that you heard speak today, just send me that email and I'll make sure that they get it and we'll answer it as best as we can. So thank you very much, everyone, for coming today.
Thank you, Steve.
Thanks, Jen.
Thank you.